Hello guys, so now we shall be discussing regarding the parathyroid glands. Parathyroid glands. So what are the different kinds of parathyroid glands we have got? Okay, actually there are 4 parathyroid glands, and where are these parathyroid glands located? These parathyroid glands are located posterior to the thyroid gland, posterior to the thyroid gland. How many parathyroid glands you have got? You have got 4 parathyroid glands. Okay. So if you look at this picture, this is the anterior view of your thyroid gland, right? So this particular gland over here is called as your anterior view of your thyroid gland. Okay. And this is the posterior view of the thyroid gland. Actually, thyroid gland is in this way, right? So if this is the structure in the center, thyroid gland is like this. From the front you can see this entire thyroid gland, right? But from the back it is only half. Okay, so this is how the thyroid gland is. On the posterior side of the thyroid gland, you see four small glands here. These 4 small glands which are located on the posterior side of your thyroid gland are called as your parathyroid glands. So these are called as your parathyroid glands. Now out of these parathyroid glands, these 2 are called as the superior parathyroid glands, and these 2 are called as the inferior parathyroid glands, superior as well as the inferior parathyroid glands. Now if you see superior parathyroid glands, right, how many are in number? There are 2 superior parathyroid glands. Now embryological point of view, from where does these parathyroid glands that develop is that they develop from the 4th pharyngeal pouch. Okay, they develop from the 4th pharyngeal pouch. Okay, these parathyroid glands develop from the 4th pharyngeal pouch. In the same way, when you look at inferior parathyroid glands, from where these inferior parathyroid glands develop? These inferior parathyroid glands, they develop from the 3rd pharyngeal pouch. They develop from the 3rd pharyngeal pouch. So how many pharyngeal pouches we have got? We have got one is called as a 4th pharyngeal pouch, another one is called as a 3rd pharyngeal pouch. Okay. Now these are the 4 parathyroid glands which you can see over here, right? So in another picture here, so this part is your thyroid gland. So this is a picture from the posterior aspect. Okay, in the posterior aspect, what are the important things you can see? This is a posterior surface of your thyroid gland. Next, you have got 2 yellow color structures on the top. These 2 structures are called as superior parathyroid gland, and down here we have got is the inferior parathyroid gland. Now, who is supplying these parathyroid glands? Parathyroid glands are supplied by inferior thyroid artery. They are supplied by what? Your inferior thyroid artery. Now, when it comes to the veins, the artery is inferior thyroid artery. But when it comes to the veins, what are the different kinds of veins here? There are 3 different veins. Again, the same. When we discuss thyroid, you might have understood what are the veins there. The same veins are applicable here. Superior thyroid vein, middle thyroid vein, and inferior thyroid vein. So, we have got is the superior thyroid vein. Next we have got is the middle thyroid vein, and next we have got is the inferior thyroid vein. So superior thyroid vein, middle thyroid vein, as well as the inferior thyroid vein. Next, coming to what are the lymphatics over here, you just have to remember these things. Coming to the lymphatics, we have got 2 different types of lymph nodes. One lymph nodes are deep cervical, and the other lymph nodes are located on either side of trachea. For example, if this is a trachea, on either side of the trachea, we have got lymph nodes called paratracheal. Anything located on either side is called paratracheal. So the lymph nodes are, one is called as a paratracheal lymph nodes, and the second important one is your deep cervical lymph nodes. Deep cervical lymph nodes. So 2 important lymph nodes over here. One is called as your paratracheal lymph nodes, and the next important one is called as your deep cervical lymph nodes. Next, after that, what is the function of this parathyroid gland? You know, parathyroid gland releases a hormone that is called as parath hormone. Parathyroid gland releases a hormone called as parath hormone. And what is the use of this parath hormone? what does it do is that, for example, let us say this is your bone. Okay, this is your bone, and let us also tell that this is your bloodstream over here. This is your bloodstream over here. What does this parathormone do is that, let us say this is your, this particular one is your parathormone. Okay, this particular one is your parathormone. Now what does this parathormone do is that this parathormone will travel all the way and start coming to the surface of the bone. Now on the surface of the bone you have got very special cells. These special cells are called as osteoclast cells. What does it do? These parathormone cells, they will activate your osteoclast cells, and once osteoclast cells are activated, osteoclast cells do a function called as bone resorption. Okay, bone resorption. What do you mean by bone resorption? Bone resorption is also called as a demineralization of the bone. It means, for example, you take a knife, right, and you stab the wall. When you are stabbing the wall, when you are hitting the knife to the wall, whatever cement that is deposited on the wall will fall down. The same thing these osteoclasts are doing. These osteoclasts, they go hit the bone. As they are hitting the bone, what is happening? On the surface of the bone, you have got lots and lots of calcium. You even have got, let us say, lots and lots of phosphate, right? So what is happening overall is that the calcium and the phosphate, right? So the calcium and the phosphate, they are entering down into your bloodstream. Calcium and phosphate are entering into your bloodstream. Okay. Now, as the calcium is entering into your bloodstream, the levels of calcium within the blood will increase. So whenever there is low calcium within your body, whenever, let us say, you are eating food, right, and which has got no calcium, let us say a patient is completely malnourished, is not taking any kind of nutrients, anything. So obviously there is no sufficient amount of calcium in his body. So in that case, what will happen is that your parathormone, whatever is there, it will go, does the resorption on the bone, and it brings the calcium back to the normal. Okay, your calcium levels in the blood are getting back to the normal level. But what is happening on the other side? The calcium which was on the bones is taken off. So bones are becoming weak. So when bones become weak, this condition will result in very easy fractures. So patient can have fractures. Yeah, right. So when the calcium levels are increased in the blood, normal level of increase in calcium is needed. But if the calcium levels are too high, right, calcium is somewhere between 8.5 to 10.2, 8 to 11 in between. If the calcium levels are more than 15 and all, more than the normal limit, what can happen? That condition you call it as hypercalcemia. And what will happen? This excess amount of calcium will deposit everywhere in your body, right? So when it will deposit everywhere in your body, obviously patient will result in stones, condition called as stones. Okay, sometimes even the stones are formed within the ureters of the kidney. This is your kidney over here. This is your kidney, and within the surface of the kidney, within the ureter of the kidney, you see a stone that is formed, right? Now what is happening here? In this condition, do you think the urine, whatever is there, can the patient pass the urine normally? No. So when urine is not passed normally, what is going to happen? The urine will stay within the kidney itself, right? As the urine is staying within the kidney, in a gradual time, what will happen? The kidneys will swell. You are getting it? The kidneys are going to swell. So this condition where there are renal stones, this condition is called as nephrolithiasis. And because of nephrolithiasis, what is happening? Whatever urine is trying to go out is going back into the kidneys. So when the urine is going back into the kidneys, don't you think kidneys will swell? So this swelling of the kidneys is called as a hydronephrosis. This swelling of the kidneys is called as hydronephrosis. Okay. So this is one important condition. Second important condition is that whenever you are doing thyroid surgery, whenever you are doing thyroid gland surgery, there are 90% of the times there are chances that the parathyroid glands are damaged. Parathyroid glands are damaged because they are very, very small, right? So accidentally the surgeon might cut down the parathyroid glands. So when the parathyroid glands are damaged, obviously the parathormone level will be low. right? When the parathormone level is low, the calcium level will also be low. When the calcium level is low, this condition you call it as hypocalcemia. Hypocalcemia, right? So whenever you see hypocalcemia, patient will have few important symptoms. For example, patient will complain of abdominal cramps. Why abdominal cramps are happening? It is because of hypocalcemia. Second important thing, low levels of calcium even will change your mood status. Okay, so that is called as altered mental status. Altered mental status. Okay. Third and fourth important signs. There are two important signs. One important sign is that, for example, in these patients, right, you put the BP cuff, okay, and start pressing the bulb. As you start pressing the bulb, what will happen is that suddenly there will be spasm that will be developed in the forearm muscles, and patient's hand will automatically turn in this way, right? So this is called as carpopedal spasm. Okay, so because of this spasm, the hand becomes like this. So this sign you call it as Trozzi sign. This sign is called as Trozzi sign. So Trozzi sign will be positive. Next important thing is that whenever a patient is having hypocalcemia, on the parotid gland region, you start to tap the patient. Whenever you tap the patient, this part of the cheek will twitch like this. You tap, it will twitch in this way like this. You see, this twitching is called as Chvostek sign. So this twitching is called as your Chvostek sign. So there are two important signs which you see. What are the two important signs? One is called as a Trozzi sign and the other one is called as your Chvostek sign. So these are the symptoms of hypocalcemia. Okay, and here these are the stones are one of the very important thing that are dealing with your hypercalcemia. Okay, right. So this is all you need to know regarding the parathyroid gland. So thank you so much for watching my video. Goodbye.